Dear Albalah. Gaza Strip. Doctors presented Shema Nabahin with an impossible choice: lose her left leg or risk death. The 22-year-old young man, whose ankle was partially amputated in an Israeli airstrike after doctors said he had blood poisoning, had been receiving treatment in the hospital Gaza for about a week. Nabahin chose to maximize his chances of survival and agreed to have his leg amputated 15 centimeters below the knee. The decision turned the ambitious college student's life upside down, as did untold others among the more than 54,500 war-wounded people who faced similar heartbreaking choices. My whole life has changed, Nabahin said, speaking from his bed at Al-Aqsa Martyrs Hospital in central Deir al-Balah. If I want to take a step or go anywhere, I need help. The World Health Organization and the Ministry of Health in Hamaswar in Gaza say amputations have become commonplace during the Israel-Hamas war, now in its 12th week, but cannot provide exact figures. At the hospital in Deir al-Balah, dozens of recent amputees are in various stages of treatment and recovery. Experts believe that in some cases, limbs can be saved with appropriate treatment. But after weeks of intense Israeli air and ground strikes, only 9 of Gaza's 36 hospitals are still operational. They are overcrowded, offer limited treatment, and lack the basic equipment needed to perform surgeries. Many of the injured cannot reach the remaining hospitals, which are strained by Israeli armament and ground fighting. WHO official Sean Casey, who recently visited several hospitals in Gaza, said acute shortage of vascular surgeons, who are the first respond to trauma injuries and are best placed save limbs, increases likelihood of amputation. While Palestinians flee to the southern Gaza Strip via Salah al-Din Street in Bureij. Gaza Strip, November 10, 2023. But in many cases, he said, the serious nature of the injuries meant some limbs were unrecoverable and had to be removed as soon as possible. People can die from infections that they have because their limbs are infected, Casey said at a press conference last week. We saw patients who were septic. According to Gaza Ministry of Health, which does not distinguish between civilians and combatants among the dead, more than 20,600 Palestinians were killed in conflict, about 70% of whom were women and children. Before the war, Gaza's health system was overwhelmed by years of conflict and a border blockade imposed by Israel and Egypt in response to Hamas' takeover of the territory in 2007. Thousands of people were injured by Israeli army fire during weekly Hamas-led anti-blockade protests in 2018 and 2019, and more than 120 of the injured had their limbs amputated. Even then, Gazan amputees had difficulty obtaining prosthetics that would help them return to an active life. Those who join the ranks of amputees now face nearly impossible conditions. 85% of the population of 2.3 million has been displaced and